Welcome to the Dance Science Podcast. I'm your host, the Dance Scientist, and the Dance Science Podcast intends to build connections and drive discussion on how we can improve our field and make dance science more normalized. Thank you for being here, and please enjoy today's episode. Hi everyone, thanks again for being here with me today. I'm your host, the Dance Scientist. Today is episode number 39. Today we have a guest episode with the amazing Erika I. She's a physiotherapist and she specializes in dance medicine and science. So first, thank you to Erika for being here with us today. Thank you, Erika.
Yes, thanks so much for having me.
So first, can you just tell us a little bit more about your journey in dance and what led you into becoming a physiotherapist?
Yeah, so I, like a lot of dancers, started dancing when I was really little. My older sister danced, and so I was 2 or 2.5 and would accompany her to the studio and kind of dance on the sidelines while I was waiting for her class. And one day the teacher was kind of like, well, why doesn't she just join in? So I was like 2.5 maybe when I started, probably younger than I should have been, and just fell in love with it immediately. So continued dancing through childhood and into adolescence. And when I was probably 13, 14, maybe, had a couple of injuries, nothing like super significant, but significant enough that I ended up going to physiotherapy and went to a clinic that was in our neighborhood that kind of specialized in sports medicine. And most of like the high school athletes from my school attended the clinic and they had a great reputation. And I had a great experience there, except for that they really truly did not understand dance. And so, I would come in and say I was having a foot issue and it was like prevalent when I was on point, and the physio was like, what is point? And like, why are you doing that? And like just really truly like struggling to understand. And they were open and willing to try and learn things about dance. But, in the rehab sessions and when I was like doing my exercises in the gym, I'm working out next to the basketball players and the hockey players and the soccer players and was kind of doing the same stuff that they were doing. And it really wasn't like super dance specific. So that was maybe my first little like introduction to physio and like, oh, maybe this could be better than it is. And at that point, I don't think I truly knew I wanted to become a physio, but continued dancing and sort of planned on going into dance teaching. And so I actually started doing some of my dance teaching qualifications. I'd grown up at a studio that followed the ISTD syllabus. And so I started doing the ISTD teacher training courses and I was teaching classes at my local studio and thought that that was the path that I was going to go down. And I enjoyed teaching, but what I really loved about teaching and about dance in general, actually, to be honest, was the like biomechanics and the movement and like the sciencey side of dance. I liked performing, but I wouldn't say that I like lived for being on the stage. Like I loved technique classes and I loved syllabus classes, which like everybody else was like, oh, this is the boring stuff you have to do. And I was like, no, this is the stuff I love. So even when I was teaching, that was the part I was fascinated by, was like the biomechanics and how the body moves and all of that kind of stuff. And so as I was sort of starting to teach more and realizing I didn't love having to like choreograph for year-end recital and things like that, decided that I would actually pursue a degree in kinesiology with the idea that I would probably end up in physio eventually, but kind of started down that path of kinesiology. And then from there, that sort of, as soon as I started taking those classes, I was like, yes, this is where I'm meant to be. And then that just like right away, I was like, this is what I want to be doing. And like, not just working as a kinesiologist, but then pursuing sort of physiotherapy and being able to bring dance specific skills to the world of physiotherapy. So it's sort of just like things seem to kind of click into place and it all kind of just made sense that like, okay, yes, I still want to be in the dance world, but I really truly want to be more on the sort of performance enhancement, injury prevention, injury treatment side of things, as opposed to the more creative performance aspect of dance.
And can you talk a little bit about like what kind of classes you took in your physiotherapist? Like, because in the US we call it like PT school. So like what kind of classes would you normally take? Just in case people aren't familiar.
Yeah, so in my undergrad, I was really lucky. So I did my undergrad in kinesiology, and I went to a university in Canada that actually offers either a Bachelor of Arts or a Bachelor of Science in kinesiology. And so
Oh.
with that, it's the only school in Canada that you can do one or the other. Like the other universities, they either offer like a science degree or an arts degree. But because there was a dual sort of offering, the course selection was massive. And so I did a Bachelor of Science degree, but I still had the ability to take some more of the arts focused kinesiology classes like ethics in sport and sports psychology and sports nutrition and things like that. But the science focused classes were much more human physiology, human anatomy, biomechanics. And then I had the opportunity in my fourth year to actually specialize in athletic injuries. And so it's not an athletic training program, but the fourth years, if you apply into this kind of like subset program, you actually get assigned to a varsity team for the season and you work as like a sideline trainer with them. So that was really my introduction to like injury management and sideline training and things like that. I worked with women's rugby for a season and actually continued to work with women's rugby for quite a few years after I graduated. So that was sort of my undergrad. And then when I went into physiotherapy in Canada, it is a master's program, but it would be the same curriculum essentially as a DPT program in the US. So when they were all kind of like switching over probably 20 years ago or so now, for whatever reason, Canada adopted as a master's program and the US adopted it as a doctorate program, but they are essentially very similar curriculum. And so again, we're taking classes in neuroanatomy, human anatomy, physiology, pathology, yeah, those types of things.
Yep. And just like interesting story because I had a similar story in high school when I went to just a regular PT and I had a similar experience of if they don't know dance, right? It's kind of like talking to a wall, right? Cuz they have this knowledge, but their knowledge is like kind of in a box, right? So can you talk a little bit about like what the value is behind dancers seeing dance specific physiotherapists? Like really like what are the benefits behind it?
Yeah, I always liken it to just like speaking a second language. Like it's almost like if you go to see a sports PT, they're probably really, really good at what they do, but it's almost like going to see a PT who's working in another language. Like if you were having to see somebody in like French or Spanish or something like that. Whereas if you go to a dance specific PT, they are speaking the same language as you. So I get dancers who come in the clinic and they can just say to me, oh, when I do a développé a second, I get a popping in my hip. Whereas if you go to a regular PT or a sport specific one, they're going to look at you like, what on earth is a développé a second? Like they have no idea. They're used to running patterns and maybe throwing biomechanics or things like that. So I think that's the biggest value is truly understanding just the language and for dancers to be able to describe what is going on in their body in their own language and have somebody understand that. And then the other big value that I see is understanding the environment. So, or the culture of dance. So we all know that dance is like a really specific culture and a really specific environment. And whether that is as a competitive dancer or if you're in a professional setting or a vocational pre-professional program or whatever the setting is, I know what all of those settings are in terms of like potentially what a dancer is dealing with in from, like psychological demands, from just like training intensity, from all of that perspective. And so again, just having somebody who understands the culture of that then means that I can tailor their rehab program to that environment. And this kind of ties both of them together, but in terms of progressing dancers back into either the studio or back onto stage, we do what are called, well, in dance, we call them a return to dance program. In sport, we call it a return to sport or return to play. But for me to be able to do that well, I have to understand what the demands of dance are. And so if I have a dancer who's coming back onto stage or back into the classroom, I can really tailor my return to dance and say, okay, to start with, you can do like petit allegro, but you can't do grand allegro. And I don't want you doing any like grand allegro where you land on your left leg or things like that that are really specific. Whereas a general PT might just be like, maybe you shouldn't jump. And so it like just can be so much more specific if you have somebody who truly understands where that dancer is coming from.
Right. Like we can't compare a football player's demands to a dancer's demands, right? A modern dancer specifically, right? It's like comparing
Absolutely.
oranges, right? Yeah. They
Yeah.
can't.
And you don't want me rehabbing I mean, and yes, I can do basic rehab with a football
Right.
player, but if it was like a return to sport program for a football player, you don't want me doing that. Like, I don't understand the demands of that sport enough to be the best person for that job. And so I will refer out to somebody else. And the same sort of applies to dancers. Like, if possible, and I know it's not always possible for
Right.
people to seek out dance specific healthcare, but if they can, you're just going to get like slightly better quality care than somebody who's having to make things more generalized because they just don't know it intimately enough.
Yeah, I always say that. I mean, I know that some people, live in these rural areas and sometimes they don't have access to dance specific physiotherapy or PT, So again, if they do have access and if they do have these opportunities to get dance specific rehab, then of course this is what the two of us recommend for sure. Yep.
Yeah, when at all possible.
Yes. And then how do you kind of see this like progressing the field of dance science?
Yeah, so I think when we look at the field of dance science, like there's so much research that goes on sort of like behind the scenes and people who are doing such good work in the field of dance science. And that information doesn't always reach the dancers or the dance teachers or like the studio settings super easily. And so as a dance physio, I sort of see one of my roles as being a little bit of like that intermediary where I can understand the research. I spend a lot of time staying up to date with the research, going to conferences, things like that. And then I can take that information back to my local community. And whether I'm imparting that information like directly to a dancer that I'm working with, so like one-on-one and telling them the latest research, or I do a lot of workshops and like courses for dance teachers and things like that to try and disseminate that information and be a little bit involved in that knowledge translation to the actual dance community. So I think that's one of my biggest roles, is to be able to be a bit of like an intermediary between the researchers who are doing amazing work, but then actually making it applicable to the people who need that information in the field.
And so, if there was a student interested in pursuing becoming a physiotherapist and kind of like following your footsteps, is there some kind of advice or like piece of wisdom that you would offer them?
Yeah, I mean, I would say join as many of the organizations who are doing kind of dance medicine and science work as you can. So I just got back from the IADM, so the International Association for Dance Medicine and Science. I just got back from their annual conference. So anytime I get this question from students or people like wanting to kind of follow a similar career path, I always encourage them to get involved, whether it be IADMS or PAMA, the Performing Arts Medicine Association, or I'm in Canada, so we have Healthy Dancer Canada, or any of these organizations. They all have fantastic resources. They're great networking. A lot of them have continuing education options. A lot of them have annual conferences. So that's usually my first advice, is just try and get involved in the community from that perspective.
Yeah. Because honestly, like that's where I met a lot of my first, that's where I made a lot of my first connections.
Yeah, me
Even before
too.
I graduated from undergrad. I mean, I was going to my first conferences because I was interested from a as a young dancer, right?
Yeah, for sure. And at up to this point, and hopefully this will change in the future, but like as of right now, there aren't any dance specific PT programs. Like they are all generalist programs. So no matter where you're going to school, you're going to be doing a program that is more general. And so if you're interested in the dance side of it, it is a little bit up to you to find that and be able to like kind of apply that education into a more dance focused setting. So those organizations are incredible. I was also lucky enough when I was doing my master's program, we have to do a certain number of practicums as part of the program. And I actually was able to do one of those in a dance specific clinic. And so that was a way that I kind of also got a little bit more exposure. And so that's definitely a possibility for people if they're already, enrolled in a PT program, is to looking at like, okay, can you, for one of your practicums, look at doing it at a dance specific setting? But if you happen to be somewhere where that's not an option, then certainly getting involved in some of those organizations is such a great sort of way to get your foot in the door and make a lot of great connections.
And then, is there something that you wish you knew as a young dancer and why?
Oh my goodness, that's
Love this
the yeah, the laundry list of like everything. I mean, I
cliffhanger.
think I think I just wish I knew how to utilize my body, but also our body. So if I'm thinking about like the people that I danced with, how to like utilize our bodies better. So we grew up in, and I had great training and very technical training and really wonderful teachers growing up, but it was still all just based in that tradition of like how dance was traditionally taught. And so there was nothing about it that was individualized to how my particular body worked or how, you know, the next person's body worked. And I always laugh. One of my best friends to this day, we grew up dancing together and we could not be more different from a physical perspective. Like I'm quite hypermobile. She is like very not hypermobile. Like we're just so different, but we always laugh about like we were taught exactly the same. Whereas nowadays, I think we'd be able to, you know, adapt training a little bit more to really be able to individualize things a bit more. And so we're not forcing some people to do things that are maybe unsafe for their bodies and giving other people tools to make things a bit easier given their own body structure. So yeah, that's one of the things I wish I had known is that there's room for that individuality.
Yeah, because, like the way that you word it too, it kind of reminds me when I went to undergrad and when I took my very first dance kinesiology class and learned just very basic anatomy. And then all of those light bulbs started going off. And then I started realizing, just like you were saying, things about your own body that you don't realize, right? Like, oh, that's why I always struggled with that right développé to the side, for example, right? Like you
Yeah.
start to realize things. And again, it's like, teachers teaching things to dancers in the same exact way when that really shouldn't be the case because there's a lot of like of those individual factors that we should be considering, right? So I just like the way that you worded it with the word like individuality. Yeah, I think that's a good way to word
Yeah.
it. Yeah. And dancers can kind of take that home with them today.
Yeah, for sure. And I mean, there's still a lot of work to be done in that field. I think when you go into studios, like there are still, unfortunately, studios that are still teaching in that way, or teachers who maybe are still teaching with more traditional or like old school methods. But I think that's where we're seeing a lot of change and a lot of improvement is people recognizing that, you know, there's better ways that we can be doing things to get better results from our dancers.
Yep, and I also like to say it doesn't have to be like large sweeping change, right? Like we don't have to change every single thing in the dance world like with like the snap of a finger.
Yeah,
It can be
absolutely. Like little changes make such a big difference.
exactly one literally one thing can make
Yeah,
such
for
a big
sure.
difference. So what's like one of your favorite things as a physiotherapist?
Oh man, I like love everything about my job. So if I go more sort of large scale or more overview, my favorite thing is teaching. And so like physio really is a job where you spend a lot of time teaching. And I think like my sister's a teacher. We have a lot of teachers in the family. If I hadn't become a physio, I probably would have gone into education, whether that's dance teaching or other sort of forms of teaching. But I love teaching and I love taking kind of complex concepts and breaking them down into more simple, digestible, understandable concepts. And so I spend a lot of time teaching dance teachers, so doing sort of injury prevention and applied dance science courses and things like that for dance teachers. And that's one of my absolute favorite things. But if I think about even in clinic and the interactions I have like with dancers and with their families, it is the teaching aspect of it that I love. And making things understandable to them, whether that is understanding how their own body works or understanding concepts in dance science or things like that. So I think, yeah, big picture, my absolute favorite thing is teaching, but I also just love interacting with people. So whether, again, it's one-on-one interaction or more of like a group setting in like teaching a course, I love interacting with people, but I think it's the teaching part would probably be my number one.
And then what is your biggest challenge?
Breaking down stereotypes and sort of fighting against the old traditions. Like there's just so much of that sort of tradition in the dance world, and in some cases, unwillingness to change. And so sometimes it can feel a little bit about like banging your head against a brick wall. And so, and I even get dancers who come in and say, you know, I know that like I should be doing X, Y, Z, or that this is like not good for me, or whatever they're saying. And they're like, but my teacher says, or but I can't do that for some reason, or but, and so you're still like, even with the dancers who sort of quote unquote know better, they still struggle to implement that in some of these cultures that are still so steeped in tradition. So I think that's the biggest challenge is kind of convincing people or being able to get people to buy into the fact that we can change the culture of dance for the better.
Yeah. And then you were talking a lot today, like about the courses that you offer teachers. So can you talk a little bit about like what kind of courses you offer? I would love to know a little bit more.
Yeah, so I have a whole bunch of different stuff. I just kind of every time people are like, "Oh, I want to learn more about this," I'm like, "Oh, sure, I'll like put a webinar together or whatever." So I do a lot of like one-off webinars that can be on like completely random topics, periodization in dance or just managing injuries in a studio setting or just common dance injuries, things like that. But my two more kind of signature offers or bigger courses that I offer, I have one that is an online course specifically for dance teachers. It's called Flexibility Foundations. And so it is a flexibility training program for dancers, but it's based entirely in sort of neuroscience. So harnessing the power of the nervous system to get the mobility gains that we want in our dancers, but without kind of unsafe or extreme stretching practices that we're used to seeing, like overstretching or forcing stretching and things like that. So that's a totally online program. So I get people from all over the world who take that, and I usually offer it sort of twice a year, and it's 4 weeks. And then I do a in-person course. I have not turned this one online yet, although people keep asking. That is an applied dance science course for dance teachers. So it's called the Savvy Dance Teacher. It's a 2-day in-person course. We cover like everything dance science related. So we go through injury prevention, we go through periodization, we go through training load management, we talk about functional movement assessments, we look at active mobility, we look at strength training for dancers. Like it kind of covers a huge gamut of things. And again, that one is like an in-person course at this point.
So those are your like main courses, I see.
Yeah.
And then are those webinars as well? Like your,
So
sorry.
So there's no worries. There's an introduction to the flexibility one that's called
Yeah.
Neuroflex that is like an online webinar.
Okay.
The Savvy Dance Teacher doesn't have an online component at all. That one's, like I said, at this point, just like only an in-person course. And I only offer that one once a year in the summer. And I just kind of move around locations, although I might be offering it more than once this summer, just in different locations. So that one doesn't have an online component. But yeah, the Flexibility Foundations has like an intro webinar that's called Neuroflex.
I see. Yeah. I think the flexibility one sounds really interesting too. Yeah.
Yeah, it's a really fun course to teach because you got all these like light bulb moments where teachers are like, oh, like that's what was holding this dancer back, or oh, like this is how I can actually like get these gains without the dancers like hating every moment of a stretching class and that type of thing. So
And that's
yeah,
like,
it's a really fun one.
yeah. And like the way that I look at it is like you're still achieving what the teacher wants because of course the teachers want, I mean, let's just be honest, the teachers want more flexibility. Like,
Yeah.
what we
Well, the
agree
dance world demands it right now.
right now they just want it. Like it kind of just is what it is, right? So you're helping them get there, but in a smarter way. So it's like
Yeah.
who would argue with that? It's just it's
Yeah.
amazing. I love that. Love
Yeah,
that.
and that's exactly what the course is meant to do is like not say, because I mean, we could say like, don't overstretch all we want, but if a dancer is like, that is the only way that I can like
It's like, okay,
gain the
well,
flexibility that is necessary to be successful in the dance world today, then I'm going to keep doing it. And
yeah.
so this again, yeah, is sort of giving the teachers different things that they can use in class to get the results that they need and that their dancers want, but without them having to resort to sort of things that they know are unsafe. The teachers who sign up for that course are teachers who they know that like overstretching and things like that are not what they should be doing, but then they're like, well, then how do we get the flexibility that we need to be successful? And so those are the teachers who end up signing up for it. So it's always a really great group of teachers to work with.
And so are most of the people that sign up for your courses like on like the less side of like anatomy knowledge, like on the lesser of the, or are some of them like PTs or like do you kind of get like a mix of students? I'm just curious.
Yeah, I think it's a really big mix. I certainly do get some PTs and stuff who sign up, especially for the flexibility course, because I think they're just interested in that learning more about like that approach to like mobility training, like sort of the nervous system approach. The dance science course, like the teacher, the in-person course, that I would say is often really experienced teachers, which I always find so fascinating because it's like you feel like you're like preaching to the converted. Like the ones who are coming are the ones who are generally probably like doing things right already and they just want to like learn more and like so
The one
I
that go
often get
to conferences, yeah.
yeah. This year, though, interestingly, I partnered up with a local dance competition and they give out a lot of scholarships. And so we actually developed a scholarship specifically for emerging teachers, so teachers with less than 5 years of experience. So this year, like this past summer, it was a bigger mix of teachers on the course, which was really nice to have a little bit less experienced teachers with like the ones who, have 30 years of teaching experience who,
Nice to
yeah,
give younger teachers a chance too.
yeah, and I think a lot of times, especially if you're early in your career, they maybe don't have as much like, disposable income to invest in continuing education and things like that. And so for me, like they're the ones who I think really can benefit from the information. And so
To me, that says
it's a
a lot.
program we're going to continue going forward, and it's been really great.
Yeah, to me that says a lot if like a young teacher is signing up, even on their
Absolutely.
if they're, they're willing to learn and, investing their time and energy. That's
Yeah,
amazing.
for sure. Yeah.
That's a promising thing for our field too. And even older
Yes.
teachers, even older teachers who get stuck in their ways too. Any, teachers of any age can get stuck in their traditions,
Yeah, absolutely.
So that's awesome. I love that.
Yeah.
Is there any piece of wisdom that you'd like to leave with our audience today?
Oh, wow. That's like, um,
Weighted question.
I know exactly. A piece of wisdom. I mean, I can think of so many things that I think are like important for people within the dance world to sort of understand. But I think in terms of wisdom, I think we need to do a better job in the dance world of honoring people's bodies. Like inherently, people know what is best for their body, and our bodies know what is best for our body. And so if we are like getting warning signs or things where your body is like fighting back against things and stuff like that, we tend to like ignore that or push through that in the dance world. Or we have teachers who potentially are like, oh, we're gonna, ignore what that dancer is telling us and continue to push and things like that. And so I think if people could just, yeah, spend more time really honoring the body and like the wisdom of the body and really listening to their body, I think we can actually make progress forwards in terms of like the health of our dancers.
Yeah, I mean, dancers are good at ignoring. I mean, if we just have to be honest with that,
Yeah,
we
absolutely. And part of it is like they've
signs
been trained to do that.
from a young age.
Yeah,
Yeah,
absolutely. And so trying to
yeah,
get out of that habit and really encouraging dancers to listen to their bodies, and then for teachers to then also listen to that too, I think is a way forward.
right. And I mean, that can go a long way from a young age. Like pain doesn't have to be something that's celebrated, right? It doesn't have to be, you know, a get,
Yeah.
it doesn't have to be looked at like that, right?
Absolutely. And as much as we can, we try and get away from that. And that's one of the things I talk about lots on the Savvy Dance Teacher course is this idea of like that no pain, no gain. But even because teachers sometimes struggle with, sometimes things are uncomfortable when we're dancing. And especially if we're trying to make progress or like working hard can feel uncomfortable. And sometimes little kids don't know what that feeling is in their body. And so really trying to give them language around that is not pain language. And so we can talk about something feeling like hard or something feeling, like different sensations that they might feel in their body, but not saying like, oh, like no pain, no gain, or like that's good pain. Because like this idea of like good pain versus bad pain, but our nervous system doesn't know that. Our nervous system just knows pain is pain, and pain is an alarm signal, and it's not something we should ignore. And so I think sometimes we really need to teach kids and give kids the vocabulary around that so that when they do have actual pain, we can
Right.
listen to that and we can honor that pain in the body so that they have the language to say, oh, I just, my muscles are like sore because I worked them hard versus I have pain in this
Right.
muscle.
Like there's an actual difference. Yeah.
Yeah,
And like
absolutely.
define it with the actual words is important. Yeah. I like
Yeah.
how you do that too. So that's what you're talking about with like the nervous system behind things. I love that.
Yeah. Yeah.
I,
And that's, yeah, I'm fascinated by the nervous system and definitely nerd out about it a lot. And so, really, that's kind of like the lens that I come to a lot of things from the body about. And so, really trying to, yeah, share that information with the dance community is one of the things I love doing.
yeah. And it's something simple that again can go a long way. And I love
Hmm.
that message. So thank you so much to Erica for being here with us today.
Yeah. Thank you so much for having me.
Yes, thank you.